Hi everybody. This video I wanted to present my report on the second suspected viral infected autopsy on a female body whose age was aged around 68 years. I think you might have noticed that I told it was a suspected viral infection. Reason being was what we started or were looking for was the coronavirus because it was a suspected COVID infection. And what we found out was something else, but it was confirmed that it is a viral infection. So coming to the circumstances under which brought me to examine this body was I got a call from one of the US citizen from US calling me and requesting me to conduct an autopsy on his mother. He had two important requests for me. One was to find out that his mother died due to corona or not. The second request was he wanted to know what exactly was the cause of death. So this was the first of its kind of so-called private post-mortem examination carried out in the country. And for me, this is the second suspected COVID autopsy which I have done. So I just fixed the autopsy date and the time and requested the family members to bring the body along with the case files. So when I went through the case file, the patient was treated in a very reputed hospitals in Bangalore. And the case file clearly indicated that she was admitted for COVID positive for nearly 25 days back. But later on, the same patient, the RT-PCR test proved negative for COVID-19. And she eventually died after some 20-25 days after admission. So when I started examining the body and after a thorough dissection, I was able to see a gross difference between the first COVID autopsy and the second autopsy, where the lungs in the first COVID autopsy weighed around some 2,200 grams, whereas in this it hardly weighed around some 860 grams. And what I was able to see is the infection to the brain, and all were of viral origin. And even clinical notes clearly indicated that it was lymphopenia, that means the lymphocytes has totally come down, the D-dimer values have been increased, and at the same time the chest X-ray did indicate ground glass appearance of the lungs and complete destructions of the lungs. The gross examination of the lungs did indicate that there were hemorrhages, there were infarcts, and there were even emphysema changes, but the lungs were not firm as we saw in the first autopsy. But the brain did indicate isolated hemorrhages and areas of infarcts. But the lungs, the heart and the kidney and the liver did indicate the age-related changes at the same time. The ischemic heart disease of the heart and also the pyelonephritic changes in the kidneys and fatty changes and also infarcts and necrotic changes in the spleen. And the microscopy clearly indicated that the lungs were completely complete alveolar damages, destruction, and fibrotic changes, extensive fibrosis, and interstitial pneumonitis. Whereas in the first autopsy, we saw what was the main findings were thromboembolic phenomenon. Of course, here also we did find thromboemboli, but we didn't find the ion changes. But there in the first autopsy, we did find that ion changes, but we saw a lot of fibrosis. And what is the most prominent difference we saw between this and the earlier autopsy was in the brain we saw infection due to virus. A lot of lymphocytes we found in the brain, which clearly indicated a viral infection. I took 6 swabs in the body, and one was through the nasopharynx, the oropharynx, the trachea, the lungs, the brain surface and the cavity, and also the genital surface. And none of these proved any COVID coronaviruses, because RT-PCR proved negative in all these swabs taken from the body. Even the clinically it was also negative, but the lungs were completely destroyed, and the infection of the brain due to a virus. So the conclusion of this is there is a lot of gross difference and microscopical difference between the first COVID autopsy and the second COVID autopsy. And above all, the microscopic changes clearly indicate it is due to virus. The RT-PCR clearly indicated that it was a negative. That means it was not SARS-CoV-2. So we can categorically state that there is a virus which is causing deaths and infection and big havoc, and that virus is not been detectable by RT-PCR. And that means to say that this new virus has to be identified and its genomic sequence has to be studied. And the same information I have shared with the Prime Minister, the Health Minister. So the more important information which we can draw out of this whole autopsy processes, that I request the countrymen, that especially people from Bangalore, because this was a strain, this was an examination done in Bangalore, that please don't come out of the house. Save your lives. The reason being is that this is a virus which RT-PCR, though it is negative, is causing a lot of destructions to the lungs and the other organs. The brain been infected. Though in this patient, the patient died due to complications of chronic ischemic heart disease, which is possibly the disease process might have advanced due to this viral infection. But the end result is that never step out of the house, because this is the only way you can serve the country. More importantly, you can save your lives, because it causes the present situation, given the number of cases. It is not only the crisis related to corona, it is the crisis related to the collapse of the health system. So more the number of cases, the more crisis will be in the health system. So to avoid this, and above all, that since we don't know the type of strain of virus and the type of disease process, so it is very difficult for even the clinical management. So I also urge the government to conduct more to encourage conducting more such autopsies, so as to understand the different viral strains or different disease process in an individual.